Good afternoon. My name's Chris Rubish. I'm the president of the Minnesota Nurses Association. I'm here with some of my fellow union members from M&A and other healthcare unions to talk about how important it is to pass anti-retaliation legislation for nurses and healthcare workers across our state. We are seeing a patient care crisis, and healthcare workers need protections to speak up when we are experiencing unsafe patient care conditions. We need to remember that healthcare workers' working conditions are patients' healing conditions. M&A members are reporting larger volumes than ever of instances of being retaliated against. And our members are reporting that 40% nurses of color experience 40% more retaliation. This is an issue that is fundamental to not only our working conditions, but the conditions that our patients experience when they're in the hospitals. It is so crucial that our elected officials listen to the experts at the bedside who are providing care. Every single day, Minnesotans are coming to our healthcare facilities expecting world-class care, and we want to give them that care. But we need the protections to speak up when we see things that are unsafe, because patient care is at the center of what we do. And I'm so proud to be here with my coworkers and fellow labor leaders. I'm proud to introduce Megan, one of my colleagues from M&A and the M&A Board of Directors, to speak about her experiences working at the bedside.
Thank you, Chris. My name is Megan Madison, and I'm a registered nurse at M Health West Bank. For the 22nd year in a row, nurses have been voted the most trusted profession in the nation. Yet who doesn't trust us? Our employers. As outlined by the Minnesota Nurse Practice Act, we have a duty to report unsafe conditions. Our pleas for help continue to go unanswered. To keep our jobs and to pay our bills, we are faced with making do, and that's just how it is. We get told to file a report. That report gets reviewed, hopefully within 24 to 48 hours. When lives are at stake, we don't have the luxury of time. Healthcare workers know what they need to make a situation safe, but those resources are allocated by people in offices who see us as a financial burden, not a critical partner in patient care. They aren't there at 10 p.m. on Saturday night like we are. We do face retaliation by employers for being advocates for our patients. I have personally faced retaliation in my professional judgment to protect safe patient care. And I know I could face further repercussions for speaking out. A nurse who refuses to take 5 to 8 patients when they should only have 3 gets sent home for a day. This makes an already unsafe situation even worse. A charge nurse who redirects the patient admission so they will get safe care will be taken out of that role and replaced by somebody who will, but at what cost? The HEAL Act has nothing to do with healthcare workers discriminating against patients. It has everything to do with unsafe directives from people who have never worked at bedside a day in their lives, being held accountable for disregarding the clinical judgment they pay us for. Employers are asking us to accept the risks to our licenses and our patients' lives so they can balance their top-heavy budgets. You should be outraged. We are. The last industry that should disregard or punish safety concerns is healthcare. We do not deserve to use our jobs or be punished for pleading for help for our patients and caregivers. I ask the legislature, pass the HEAL Act. Show the people of Minnesota that they deserve the highest levels of care. Minnesotans, as patients, your healthcare providers need you to contact the people elected to represent you and tell them to pass the HEAL Act. Your safety and our safety depend on it. Thank you. We'll have Bernie speak next.
Thank you, Megan. Good afternoon. My name is Bernie Burnham, and I'm the president of the Minnesota AFL-CIO, the federation of more than 1,000 local unions who represent over 300,000 working people in Minnesota. I'm here today because the HEAL Act is a piece of legislation that will protect all Minnesotans, whether they work in healthcare or are receiving healthcare as a patient. During the COVID-19 pandemic, Governor Walz empowered workers to report unsafe working conditions without the threat of retaliation. While we don't know how many lives that executive order saved, we do know that Minnesotans are the most protected when we put safety before profits and so-called efficiencies. Unfortunately, our state's healthcare professionals aren't protected from retaliation if they do the right thing and report unsafe conditions such as inadequate staffing levels. That lack of protection puts both worker and patient safety at risk. When care workers are scared to speak up, it is patients who suffer. If hospital executives prioritized worker safety and patient outcomes instead of balance sheets, we wouldn't need to be here today. But the fact of the matter is that healthcare workers are far too often punished for following their conscience and their own professional judgment. Minnesota's labor movement is united in support of the HEAL Act, and we are asking lawmakers to listen to the people who deliver health care every day and not the wealthy executives squeezing every dollar they can out of workers and patients. Thank you.